podcast. Elizabeth, how are you doing today?
I'm doing well. Thank you. I'm excited to be here.
Yeah, excited to have you. It's always fun for me just to learn from new people and meet new people, and that's the best part of having a podcast is I get to talk to so many people who do so many different amazing things, much more complicated than what I do. So it's always good to learn.
It's great.
Well, before we kind of dive into today's topic, we're going to be talking a little bit about niching in therapy practice or niching, however people want to say that. I never know which way is the correct way. But anyway, why don't you tell us a little bit about yourself, who you are, what you do, and tell us a little bit about your story, how you got started doing what you're doing today.
Yeah, okay. Well, I'm a psychologist. I live outside of Boston and I run a small private practice, but spend the majority of my time currently as VP of Clinical for Alma, which is a behavioral health technology company that supports about 22,000 clinicians across the country who are running private practices. Um,
Great.
so I've taken a bit of a winding path through my career, and it's one that I like to talk about because I think in terms of thinking about developing a niche or kind of identifying your interests, I've had a lot of opportunities to do that along the way. My interest in the mental health field actually was born through my involvement as a pre-professional ballet dancer,
Oh, wow.
which is a little counterintuitive for a lot of people. But I trained as a dancer and um, was involved with a company at a point at which a young dancer died of complications of an eating disorder
Wow.
and felt really, I would say, a combination of confusion and commitment
Mhm.
in terms of thinking that this seemed like a really tragically unnecessary outcome.
Yeah.
So the early part of my career was really focused on eating disorders and primary prevention programs and women's health, I'd say more broadly. So through grad school, that was really my focus, was understanding female development, looking at ways in which the mental health profession could support women and girls who were in environments where there was high risk of developing an eating disorder or other mental health concerns. Um, but after that, I moved on to doing my formal postgraduate training, and I did so in a large primary care organization in the Boston area. And in that environment, we were expected to be generalists.
Hmm.
We saw whoever got put on our schedule.
Right.
And given that we were in a very urban area, um, that meant we would see all kinds of people from different backgrounds with very different presenting concerns. And it was a
Yeah.
really great opportunity to try a little bit of everything.
Right.
Um, and I think it's wonderful when clinicians have that experience early on because
Hmm.
it's hard to know what you want to do until
Yeah.
you've had the opportunity to try on a number of different hats.
Yeah.
Um, and it was in that environment that I really became interested and focused on women's health, particularly in the reproductive health space,
Hmm.
and got involved in working with women who were struggling to get pregnant, experiencing fertility treatment, experiencing pregnancy loss, and then seeing people through pregnancy and into the postpartum transition.
Hmm.
I don't think it's coincidental that that really was happening parallel to my own process of becoming a parent. I think
Hmm.
often I find that in my own life and in the clinicians I talk to, that there are ways in which our specialties kind of evolve with our lives and our own
Yeah.
journeys.
Yeah.
And
Hmm.
so I think that actually helps us remain really close to the why of the
Yeah.
work that we're doing.
Yeah.
Um,
Absolutely.
so really got to spend a bunch of time in that space. And then beyond that, I think really also wanted to find opportunities to teach, to mentor, to supervise, and to kind of fundamentally be involved in supporting clinicians.
Yeah.
And so that led me ultimately into my current role at Alma. I would say the other thing that I would add that is important in terms of my specialty and my identity as a therapist is that about 10 or so years ago, I was introduced to acceptance and commitment therapy. It was kind of a random introduction, one of those like fortuitous meetings, and that really changed the trajectory of my clinical identity pretty significantly. And so at this point, I really consider myself primarily an ACT therapist, and
Hmm.
really am deeply involved in doing that work, but also training others to do the same. So that's a little bit about my pathway to get to this point.
Yeah, that's great. And there's a few things that kind of stood out to me that I want to kind of go back to that I think will
Yeah.
really help those listening. Especially the part about when you first started, like focusing on that, being a generalist, because I speak to many people who they kind of, when I'm consulting with people, they're starting their marketing journey and they obviously want to get a website and get their name out there. Um, and so we'll start to talk about, what goes on the website as far as the content, who do you serve? What do you do? And people will often say sort of, as like an aside, like, I know I'm supposed to niche down, but I'm kind of doing this, and the other thing. And we talk about niching down a lot, and sometimes it
Mhm.
becomes this thing that like everyone feels like, oh, I have to do, or I have to do right now, that sort of thing.
Mhm.
And so I just want to kind of make note of that because if you are just starting out, like being a generalist and kind of finding your way, it takes a little bit of time. And that was definitely my wife's experience in her private practice. I'm not a therapist, but my wife is. And I remember those days, those first few years where she was taking on everyone. And she
Mhm.
was like, oh, I don't really like working with these types of clients, and like getting all these random people. But it took her time to really nail down that she loves working with people who are trying to repair or establish really good relationships, whether that's individual or couples. She kind
Yeah.
of focused in on the relationship aspect of things. But it takes some time, and it's okay, especially in those early years, like as you're finding your way into what do you love to do,
Yeah.
and who do you love to serve.
Yeah, I mean it's such an interesting point because I think it's easy for people to fall into the trap of thinking about your niche as being a marketing tactic.
Right,
That like I need to find a niche because I want to, make sure that my brand is distinct from other people's
right,
brands.
right.
And I think for other people, it becomes almost an intellectual thing.
Hmm.
Um, I actually think that the people who find a space in which they can thrive um, find that space because it speaks deeply to who they are on an emotional, spiritual, intellectual, kind of
Yeah,
values-based level. And
yeah.
the more you try to kind of superimpose a marketing lens,
Hmm.
there are things that can be valuable about having that mentality. But I
Yeah,
think from my perspective, the the foundation is in that deeper kind of more values oriented commitment to a
yeah.
particular kind of work, a particular kind of client. And once you've been able to identify that, then you can kind of broaden out the way in which you kind of share that interest or that specialty with the world.
Right. Yeah, and I think so many of us we do want our marketing to be authentic. We don't want it to be, just focused on the marketing because there is that, like you said, I love what you said about it's a values thing, for us all and especially for therapists. And I think that that's the best way to remain authentic is to really be aware of who do you love working with and why, and
Yeah.
that will then really flow into the content on your website or the marketing, the ways that you market to that population. Because at the end of the day, yeah, it is a business too, so we
Yeah.
need we
Yeah.
need to reach those people.
Yeah.
But remaining authentic, I think that speaks deeply to a lot of folks when it comes to the marketing stuff. They feel like it's one or the other. It's like I either have to be a salesman or I have to be just kind of like totally on the opposite end and not being able to speak to the right people.
Yeah. Well, and if anyone should be able to hold that dichotomy that they can be two things at the same
Yeah.
time, it should be us therapists. But I think
Yeah.
it can sometimes be easy to forget so that we can apply that skill set to our own experiences and our own journey.
Yeah, right. Well, what are some of like what are the benefits of really, honing in on your niche and who you love to work with and how you love to do it? Because I mean, it sounds
Yeah.
like I also wait, let's pause there for a second.
Yeah,
I
yeah.
also want to make note, you spoke of kind of two niches, working with women on their journey and, through fertility, infertility, pregnancy, all that stuff. But you also spoke about your specialty and your modality of act
Yep.
therapy. And so I just wanted to point that out too, because those are two ways that you can really niche down is how you do your
Yeah.
work and who you do your work for.
Yeah.
So I just wanted to point that out first.
Yeah. Well, and I would say that for me, the beauty of finding ACT was that it gave me a very reliable tool set that
Yeah.
even within a niche would allow me to kind of move freely into different spaces, whether that was talking to a patient or maybe giving a training to a group of providers or writing a blog post.
Yeah.
That having a chance to clearly define kind of the philosophy and the way in which you understand what helps people change
Hmm.
is a very powerful part of your foundation.
Yeah.
And I didn't realize that I was missing that
Hmm.
until I found it. And
Yeah.
I certainly didn't find it in grad school. I developed a
Hmm.
lot of tools and skills. I got some great experience, but I don't think it all came together in a way that felt consistent and meaningful until I found an approach that um, really both fit with who I was and helped me become more of who I wanted to be in the
Yeah.
room as a clinician.
Yeah.
Um, and then, with that foundation in place, I had the opportunity to kind of follow what felt most interesting to me on a personal level,
Hmm.
follow that interest and kind of lean into it and see where it took me.
Hmm.
And I think that often it can feel, I think people often worry about having the professional feel too personal. And there's certainly some boundaries you want to set there, but for many of us, that lived experience or that kind of deep internal sense of commitment
Hmm.
is ultimately what differentiates us in terms of
Yeah.
making us, effective and expert in what we do. And that's
Yeah.
different for therapists than people who are, let's say, maybe accountants or
Right.
developers, right?
Right. Yeah.
So, yeah,
Yeah. Absolutely. Yeah, because there's so much relation involved in what you all do, and so it has to be. It really does have to come from that deep place.
yeah,
I know. I always tell my wife I could never do what you do. But if I did, I was gonna say like I could see myself absolutely like really trying to figure out who do I really want to work with and how do I want to work with them and getting really, really clear on that. And I'm sure that takes a lot of time. And what are
yeah,
what are some of the, I guess, steps or ways that people can lean into those things to, especially if they're
yeah,
just starting out and they are maybe feeling that tension of, I'm a generalist right now, but I know I want to really focus in on and do, whatever it
yeah.
is, this population well or this modality well.
I'm a huge fan of continuing education. And I think, the beauty of continuing education is like leaning into things that you're interested in,
Hmm.
areas or clients or presenting concerns or modalities. And that, the ability to go deeper, I think can make our work so much more fulfilling. But
Yeah.
I'm also a big fan of doing things that you know nothing about.
Mm.
I think partially out of my own experience of finding ACT as, someone who just kind of randomly showed up in a training one day. But, continuing education, I think, is ultimately the bridge between an interest or a potential interest and expertise.
Yeah.
And there's so many different opportunities to deepen our understanding. But for most of us, that's going to involve getting experience, getting training, getting consultation and supervision that is above and beyond what we did in graduate school.
Hmm.
And so I was just looking at one of our education managers at Alma just sent me the list of continuing education events we're going to do in the second half of the year. And I think they're 50 different trainings. And I was, looking down the list and thinking like, I haven't worked with veterans before. Maybe I'll attend that training and just get some
Yeah.
exposure. It may not be something that I ultimately pursue, but I'd like to know more about that. Or psycho-oncology. Never had the
Hmm.
chance to venture in that space. So I think, the opportunity and the privilege, really, I think many of us treat continuing education like a chore. It's something that, like a box we have to check when we renew our license. But
Right.
I think treating it as something that actually is an investment in yourself and your career, and certainly your clients as well,
Yeah.
can help you kind of utilize that to move your professional identity forward.
Hmm.
And then I think also we often learn and develop best in communities. So finding communities of people who are interested in the same things that you are, and can make connections to you. So I've been lucky to, for instance, get to work closely with reproductive endocrinologists who are
Hmm.
teaching, who are treating fertility patients. And so that's just another layer of perspective and experience that
Yeah.
you can bring to your work, and having a community and a network can make a huge difference in terms of expanding your perspective on your specialty or your niche.
Yeah, absolutely. I love that. And as a learner myself, I know that some, like you said, some people can see it as a chore to do all the continuing education, but for me, I have to be really accountable to myself to really push myself to learn, whatever it is, web design trends or SEO and stuff like that for what we
Yeah.
do. And sometimes like I kind of wish I had a license that kind of said, "Hey, you gotta do these things."
Yeah. Yeah.
So that you can keep learning and keep up with things. But
Yeah.
yeah, I think it's a great way to really get exposed to so many different things. Different things that you normally wouldn't go after unless you really, you had that accountability to go do that. So
Yeah.
I love
Yeah.
that.
I think the other experience that I have now at Alma is, we create profiles for our providers that can be found through our directory. And I'll often talk to people about the fact that, the reality is everybody treats anxiety and depression.
Right.
Or, I know very few people who don't have expertise in that space. And some people have, very specialized expertise. But in terms of actually drawing clients in, if you just say you treat anxiety and depression, you're probably going to look more or less like everybody else.
Hmm.
And then it's not necessarily that you couldn't highlight that is kind of your bread and butter. That is what you do in your practice. But I think you mentioned this earlier, this idea of really bringing your individual personality. And that might mean, your style, the way you are in the room, the approach you take.
Hmm.
Um, it also might mean, thinking about the ways in which you think about therapy,
Hmm.
the ways in which the parts of your identity that you bring into therapy. And, one of the things I appreciate about our platform is that it allows potential clients to search for a therapist based on criteria that are, rooted in identity. So people who
Hmm.
are looking for a therapist who shares their sexual orientation or their racial
Hmm.
background or their gender, whatever. And we get mixed messages about that in our training, right? Like, we're taught to be very careful about self-disclosure.
Right.
And so I think it can be hard to know what's appropriate in terms of sharing parts of our identity with the public, right? In a
Hmm.
public profile. But
Yeah.
that for potential clients, particularly those who are new to therapy or maybe anxious about talking to someone,
Yeah.
being willing to very appropriately share parts of our identities or our lived experiences that may help our potential clients relate to us, connect with us, or feel a sense of being understood,
Yeah.
can be another very natural, organic piece of our niche that, you know, we don't necessarily choose, but we bring into our work literally every minute, every
Yeah.
session.
Yeah.
So, yeah.
Absolutely. I think that that's a great point. You know, you kind of start talking about the marketing side of things and being able to share a little bit of your journey. And I know that, you know, for me, I look at a lot of websites, especially
Mhm.
the before and after of websites and, you know, for therapy websites. And so you know, a lot of the times therapists can be kind of cold on their website. It's just like, here's the information, like
Mhm.
a lot of clinical speak, that sort of thing. But then when we take that and we transform that and share a little bit more of their personality, their voice, finding warmth and being able to relate with those potential clients, I think that's what really people are looking for that. Like people are looking to really connect because this is someone they're going to sit with and really share some of their deepest challenges or, you know, secrets, you know, things that they're going through. And so that's really is really important to feel that connection. And so
Yeah.
that's always our goal when it comes to marketing is how do we remain authentic and focus in on those people that you really love to work with, but how can you also maybe share a little bit of your story?
Mhm.
You know, obviously we don't want to disclose too much, but there's ways that you can share a little bit of yourself and your personality, and it's often those things that really connect with people to say, oh, she gets it. Like she shared an experience, you know, of whatever it is,
Mhm.
anxiety that she battled or infertility or whatever it is, and so she gets it, and so I can sit with this person.
Yeah, I agree. And I also think we have a responsibility when we have a niche, um, to educate people and to not assume that people who might be coming to us for help know what to we can't assume they know what that means or even to know
Hmm.
that they're looking for it. And so for me there's
Yeah.
also a very educational piece because I certainly don't expect that any client who comes my way has a clue what it means that I'm an acceptance and commitment therapist. Like
Right.
that, you know, that shouldn't necessarily mean much to a person who isn't in our field. And so to be able to explain what it means for you to have expertise in that area,
Yeah.
in a way that is relatable and not clinical jargon, you know, to
Hmm.
be able to give examples of what it might look like to work with me, you know, from an ACT lens, or what it might look like to get therapy while you're seeking fertility treatment, you know,
Right.
to get some examples of the kinds of things you might talk about.
Hmm.
I think it's easy to forget that all of these things may feel very intuitive to us as therapists and as
Hmm.
experts, um, but it may not be at all clear to the people who are looking for us what it is that they are looking for. And so I
Yeah.
try to adopt a very educational role in helping people to understand what it is that working with me might look like for them.
Yeah. That's great. I love that. And and yeah, just to kind of build on that, I always love to treat those potential clients of like they're in like sometimes the hardest place of their life, you know, and they're
Yeah.
searching for therapy. And so like we don't want to overload them, but we also we want to connect with them and relieve some of their anxieties. You know, because if you really paint that picture, like you're saying, like this is how I work with clients on their infertility journey. Here's some of the things that we could talk about versus maybe another website where it's just like, I work with women who are going through infertility. Like, okay,
Mhm.
great. You
Mhm.
know, I'm going
Yeah.
to go with this person because she's really painted the picture of what it looks like to sit with her. You know, maybe she's got a video on her website or I see her
Yeah.
face. Like you're creating a little bit more connection, you know, with those folks and really thinking about who is coming to my website? Who am I trying to reach and where are they at right now and kind of alleviate those anxieties?
And I think there can be something therapeutic in the act of really sharing some of these common struggles in openly on your website. So like in using the fertility example, to be able to say like, it's actually really common for women who are going through fertility treatment to experience some negative feelings towards people in their life who are pregnant or who have children,
Hmm.
because a lot of women feel a lot of shame about those issues and haven't
Yeah.
necessarily had the opportunity to recognize that this is actually often a very shared experience for people going through
Yeah.
this particular struggle.
Hmm.
Um, and so in marketing ourselves, like it's not just marketing, it actually can be therapeutic in and of itself if we
Yeah.
help identify and normalize some of the experiences that people who are looking for treatment might be experiencing.
Yeah. Yeah. Absolutely. Absolutely. Well, I know some people, kind of circle back to niching down and kind of
Yeah.
finding our niche. I know some folks, they hesitate to niche. Maybe they like really love working with someone, but they're hesitant to just really like focus in on that, especially like on their website, because maybe they're afraid that they're not going to get other clients.
Mhm.
Um, and yeah, they're just kind of worried about bringing in
Mhm.
more clients. Like, do you have any advice for folks who just want to remain generalist? Is that okay? Are they going to lose clients if they niche down?
Yeah. Um, I think, I probably take this, I take a very practical and pragmatic approach. And my question to that person will be, well, how's it working for you? It
Yeah.
may be that for certain people in certain contexts, in terms of their professional identity and their community and what's available around them, that being a generalist works really well. And I
Hmm.
would never want to discourage people from following that approach, and just encouraging them to use data to guide them. And if
Hmm.
they are building a full and thriving practice as a generalist, great.
Hmm.
If they're finding that somehow that approach isn't working quite as well as they want to and want to kind of optimize that, then
Yeah.
maybe they do need to shift a bit to be a little bit more willing to narrow down, and see whether that works. So
Yeah.
I also don't take a particularly all or nothing approach. I think you can try different things and you may actually want to, take a different approach at different points in your life. I certainly work with lots of people who will go through periods of time where they'll say, I'm really not in a place where I feel like I can show up to do trauma work the way I need to. So I'm going to kind
Hmm.
of fade that from my practice for a
Yeah.
period of time.
Hmm.
I know lots of people who are pediatric prescribers, providers who, when they have really young kids, shift and treat adults or treat older children because they
Yeah.
just want a little bit more balance. So
Yeah.
um, I'd say I, in general, endorse the idea of flexibility and really flexibility in service of doing what works.
Hmm. Yeah.
Because that ultimately, if we can evaluate our results based on like what it is we're looking to build, and we have the flexibility to change course if that's what is indicated, I think most people are going to be successful in building the practice that they want to have.
Yeah, yeah, love that. Thank you for that. That's very wise, and I totally agree because as business owners, I think that's really the best part of owning your own business is you get to shift, you get to kind of go with the seasons, like you mentioned. Maybe I don't want to work with children in this season of my life, or whatever it is,
Yeah.
or I'm really enjoying working with couples. Like, let me kind of focus in
Mm.
on that and at least add more of that to my website to make that more clear. And then, maybe in 5 years you're tired of working with couples, and you can. And that's also a great thing about websites. You can just take that page off your website,
You go
and
back to
so
working with children.
right. Yeah. You just kind
Yeah.
of shift and move and grow. And I love that aspect of just like owning the business, because at the end of the day, you have the call, you have the power. And if you're, aware and staying true to what's in your heart to do and what you feel passionate about, then you can go for it. You can do that.
Yeah. And there will always be training
Hmm.
available to
Yeah.
support whatever new pathway you've
Yeah.
chosen. And
Yeah.
I think that competence is incredibly important. And I think, from my perspective, just because I have an interest in doing something, shouldn't necessarily justify my pivoting into that space without having invested in my own professional development.
Yeah. Hmm.
To make sure that, because I might have learned about, we'll say, treating children 20 years ago in graduate school, but a lot has changed. And so if I want to kind
Yeah.
of pivot into that space, I think it's our ethical obligation as providers to make sure that we've had adequate training on kind of the most up-to-date and
Yeah.
evidence-based approaches to doing the work. So
Yeah.
I
Yeah.
think that is the piece that I think, in terms of our, time has to be
Yeah.
factored in, that,
Hmm.
we have to be in a place where we can invest some time in really sharpening our skills.
Yeah, absolutely. Well, this has been a great conversation, Elizabeth. It's
Yeah,
been
thank you.
I think it's gonna be really helpful for many people listening. And we've got just a couple more minutes. Why don't you just share a little bit more about what you do at Alma and
Yeah.
what Alma, does for therapists?
Great. So at Alma, really our mission is to make it easy for clinicians who are in private practice to take insurance. And as someone who was in private practice myself, before Alma existed, and really had to struggle to learn how to run a business, no one had taught that in graduate school.
Hmm.
And then to devote time that I really would have much preferred to devote to treating patients, to doing the work that I'm passionate about, to running a business.
Yeah.
Alma really allows people to focus their time and their energy on what they do best, and allow Alma to do the rest of the work, to allow them to get credentialed with insurance companies, to file claims, to get paid, which is always nice. And then to market themselves, to create profiles that are appealing, and to receive referrals for clients who are a good match for their practice. So I feel incredibly fortunate in that I get to, really spend every day focusing on how we can better support the needs of private practice clinicians, and
Mhm.
really work with the team at Alma to identify all of the different kinds of tools, and technologies that are going to help improve the quality of their life and the quality of the care they provide. One of the things that I'm most excited about right now, and it's actually become one of my current niches, is in talking about artificial intelligence and AI
Mhm.
as a tool for helping people streamline and make more efficient their documentation.
Yeah.
So, I think there are a lot of tools that can make therapists more effective in their work, not because the tools do the clinical work, but the tools can do the behind the scenes kind of
Yeah.
things that
Hmm.
we have to do in order to run a business. But maybe if we have the right support, it can allow us to focus on what we're actually trained to do. So
Yeah. Awesome.
yeah, so it's a lot of fun. It's and a really interesting space to think about how we can help private practice clinicians who've historically been removed from the healthcare system,
Yeah.
really help integrate them into the healthcare system in a way that allows their businesses to thrive.
Yeah,
So
absolutely. Yeah,
yeah.
Alma has been a sponsor of the Private Practice Elevation podcast in the past, and you all have been great to work with. I know you all have just great resources just to help folks grow and continue thriving in their practices. So,
Yeah.
thank you all, and thank you for your time, Elizabeth. Where can people either find you or find Alma,
Yep.
whatever you want to promote?
Yep. So you can find Alma online at helloalma.com, and on all the social medias. The best place to find me is on LinkedIn, Elisabeth Morray, Morray. And always look forward to hearing from folks. So feel free to reach out if you want to chat more about any of this. I'm open to that.
Awesome. All right, great. We'll put those links in the show notes for this episode. And thanks so much, Elizabeth. It's been great chatting with you.
Great chatting with you.
Podcast.